Uh, Imagine that you have been having a lump or a swelling in your breast, which has been there for some time. It doesn't pain you, it doesn't bother you, and you have been staying with it, going about your business until you go for a normal wellness checkup and your doctor checks you and find that there is a lump that is now getting attached to the underlying tissues, and it is changing the configuration of your breast. So we are going to look at the role of primary care in patient well-being. I'm Dr. Joshua Delito, a family physician. I have interest in cancer prevention and treatment and public health. In this video, we are going to look at the role of primary care in patient well-being. We are going to look at what is primary care. We are going to look at why do you need to have a primary care health provider, and what are the benefits of having a primary care provider. And when we talk about primary care, what are we talking about? So primary care is the first point of contact for patients. This is the health provider who patients are able to see on a consistent basis for their daily health needs and for most of their common health problems. And this helps them to be able to get into the health system. So mainly primary health care focuses on prevention, early diagnosis of diseases, especially conditions like hypertension, diabetes, common discomforts of life like upper respiratory tract infection, if you have pains anywhere, non-specific symptoms that you do not know what they are, then the primary care provider is the person to go to. And of course, there is the chronic disease management. When you have a condition like diabetes or hypertension, you need someone who is going to take you through the illness and help you as your guide to be able to manage conditions like hypertension, diabetes. If your pressure is high, what do you do? When do you need to be concerned? What complications do you expect? So this you will always get it if you have a primary care provider. And usually the good thing about having a primary care provider is that this is a person whom you can always be in contact with, and is always there for you. So there are various expectations or the various core things of primary care health providers. One, they focus on continuity of care, making sure that your health, they do not take care of you only when you are sick, but even in good health. These are people, they are providers who are able to move with you on your health journey. They start with you as a child, they move you into your adolescence, into your middle age, into your old age, monitoring your health. Then that is continuity. Then there is comprehensiveness. Comprehensiveness means that they have a broad understanding of many of the common conditions, and they look at you and be able to diagnose and treat most of the common conditions. Then there's being patient-centered. Being patient-centered means that they look at you as a patient, take care of your health needs, and guide you through the health journey. Then also the other aspect of primary care is being evidence-based. It's always good that whatever prevention or whatever treatment that you get from your primary care provider is evidence-based. And this helps you to be able to maintain good health. So as I said, 80% of the healthcare needs can be handled by primary care providers. So that means almost all your health needs can be taken care by your health provider, and then they will refer you to secondary care when you need it. And this that's why you find that when we talk about universal health coverage, then we emphasize the importance of having primary care providers so that they can be able to take care of most of the conditions. And this helps one make healthcare affordable so that they know you. They do not need so much testing, because most of your diagnosis will be based on the patient's knowledge about you, and also the health provider being able to listen to you and be able to examine you and make a diagnosis, and based on what he has you have told him and the examination, then he will base his test based on what he knows about your past, the current symptoms, and advise you on how to go about your test. And then usually your primary care provider should be someone who is accessible to you, so you can be able to call them, you can be able to text them, and they can be able to respond to you, and this makes your life easier. And when you have doubts in any issue, they can always direct you on how to get a secondary opinion. Then having a primary care provider and having a primary care health provider also helps you to prevent complications of diseases and reduce time spent in the health care system. So where do we find the primary care going in the future? We will be having a lot of artificial intelligence in primary care, with the use of artificial intelligence in diagnostics, use of telemedicine, and also the use of wearables, and this will help to predict patients' health. And then there is a shift to preventive care, and also a shift to patient-centered care. When we are talking about patient-centered care, we are talking about knowing you as a person and tailoring your treatment so that it is based on you as an individual. What is your genetic composition? What is your lifestyle like? What do you need? So that the treatment is specifically tuned to your needs, and then you are able to be diagnosed and treated, and you can be able to follow up with your primary health care provider. So I encourage you that you have a primary care provider who is always there with you, and who is following you up, and who also can advise you on when to be able to go for screening test and what screening test to go, and they also advise you on some of the common challenges of healthcare depending on your life stage, and this will be able to make your healthcare manageable, reduce the cost of your care, and also timely management of your illness. Thank you very much for watching.